everyone, and welcome to another Around the Town of Branford with Henry and Frank. I'm Frank Toohill at BCTV. We're going to be discussing today one of a couple's most hard to discuss problem. Supposing a couple that love each other and want to have a baby can't have the baby. I mean, it's hard to talk about that. Who's to blame? Is there something wrong with me? It's a very difficult, hard topic. Well, fortunately, here in the Branford area, we now have a specialized office that you can go to for help on that very topic. It's called the Center for Advanced Reproductive Services. It's a great organization. It's been in operation since 1984 in other parts of the state, and they've come down now to the Branford area. They have an office that is opening. And with us today is Dr. Daniel Groh and also Deb Heinz. And it's great to see you both here today, and thank you for coming.
Frank, it's so nice to be here. Thank you for having us.
Thank you.
Now, these people are going to be staffing the Branford office. Now, the Branford office is, what's the address of the Branford office?
6
Debbie?
Business Park Drive, yeah.
Okay, 6 Business Park Drive. That's right off exit 56. And you can go in there. It's private. It's all confidential. You can talk to them about anything you want. If you and your spouse or your partner are having trouble having a baby, having a child, this is the place you want to go. You can call them at 203-481-1707, and you can make an appointment. You can check out their great facility online, and the website is www.yukonfertility.com. That's Yukon Fertility. Now, curious to know, at this office in Branford, 6 Business Park Drive, would you tell me as to what types of problems can you handle? I'll start with you, Dr. Groh.
So most of the couples that see us, as you said in the introduction, are patients who are looking to get pregnant. And they've been trying for a year or more, and they're frustrated, and they want some help. And, we meet with them and collect their information and first try to take care of their general health and make sure that's really up to snuff and they're in a good way. But then we'll do the testing necessary to help figure out what the cause of the problem is and put them on the fastest track to help them have a child. And it's a sensitive conversation. It's a conversation that I think many couples are grateful to unload. As you mentioned earlier, sometimes they don't have too many people to talk to it about. It's something that they worry about all the time, and we'll help take charge and get them on the route to quickly having a family. As you mentioned, I think the CARS Center has been in existence since 1984, and we've contributed to 15,000 babies for couples throughout Connecticut.
15,000 children have been born since 1984 to couples that want babies due to the efforts of this wonderful place, the Center for Advanced Reproductive Services. 15,000 children you've brought into the world through your work. That is really absolutely amazing. And they're going to be they are opening in Branford at 6 Business Park Drive. You have any problems, issues, if you can't have a baby, this is who you want to see. Call for an appointment, 203-481-1707. They will help you. It's all confidential, correct?
It's all confidential.
Now, this is a place you're opening in Branford. But you also have, I understand, 3 other places in the state. Is that correct?
Yeah.
So we have our main office in Farmington, and then we have a satellite office in Hereford and a satellite office in New London.
Okay.
And so this will be our 3rd satellite office.
That's great. Mm-hmm. Now, at the office you're opening in Branford to serve the shoreline, I mean, my question is, what type of things are you going to offer the public? I mean,
great
there's
question.
procedures.
Yeah.
What procedures can you give us?
So a lot of what we do to help folks get pregnant is part of the practice is in vitro fertilization. Okay.
What's that, doctor?
So in vitro fertilization, we help a woman stimulate her ovaries with some medicines to produce a few extra eggs. And those eggs are retrieved and mixed with her husband's sperm or her partner's sperm or donor sperm sometimes. And embryos are created. And so that process of fertilization of an egg we call in vitro fertilization because it happens outside of the body. And then the embryo grows for up to 5 days in a dish, in an incubator, in its own little place in an incubator. And once an embryo reaches the blastocyst stage, which is about a 100-cell embryo, and if we put that single embryo into the uterus in a patient who's 35 or so, the pregnancy rate or the live birth rate is about 50 to 55%. And so that's a technology that we use frequently that's very successful and has really led to us being able to help many patients.
Yeah.
I had a patient the other day, frankly, we retrieved 25 eggs from, and it was a patient who had male factor infertility.
What's that, doctor?
So her husband didn't have many sperm.
Oh, I see.
Typically there'll be 20 or 50 or 100 million sperm produced, when couples get together.
That's incredible.
Right, and those sperm are often trying to find just a single egg.
Yes.
Well, this couple who went through IVF, the husband did not have many sperm at all, and we had 25 eggs, and they were seeking to find 25 sperm just to put one sperm with each egg, and they would just simply inject one sperm into the egg.
You can do that, really?
But
sperm is so small. Sperm is so tiny,
It's
but you
tiny,
can do that.
right?
You can do that
It's
today.
tiny.
That's just marvelous.
You can draw a sperm up into a needle. The sperm head's about 5 by 3 microns,
Yeah.
and just inject it into an egg, which is about 100 microns, and the 70% of the time the egg will fertilize.
Wow.
And most of those fertilized eggs will make good embryos that will lead to a healthy pregnancy. So it's a technology that's transformed our field, and that the Center for Advanced Reproductive Services happens to do very well.
Now, the average person, my question is, in the population, how many people have trouble with pregnancies? I mean, if you take 100 people, how many people have trouble out of that? What's the average?
So, yeah, about
15%.
About 15%.
15% have trouble having babies. That's kind of high.
In couples of reproductive age, from the 20s to the early 40s, together. So it's a pretty big proportion of folks.
That's a lot of people. And if you're just joining us, again, if you're having any problems having a child, if you want a baby, you and your partner, you want to see these great people, they're going to be staffing an office in Branford, part of the Center for Advanced Reproductive Services. Right off exit 56 at 6 Business Park Drive. You can call for an appointment, 203-481-1707.
We're located at the Stony Creek Urgent Care Center. We're up on the 3rd floor.
Up on the third floor there of the Stony Creek Urgent Care Center. So that'll be great. Okay, we talked about those procedures, which are unbelievable. All these advancements are going on, in this field, correct? It seems like you've made all kinds of progress recently. Is that true?
There's been a huge amount of progress recently. It's really fun. Many of the viewers will think about days when in vitro fertilization was synonymous with twins and triplets. That's really
How
not.
so?
It's, we used to back in the days. So the first IVF baby in the United States was born in 1980. So it's been around for a while. There are about 5 million IVF babies in the world now. 5 million. So there's a fair number, right? And in the early days, because our culture techniques weren't as good, we would put 2 or 3 or even 4 or 5 embryos into the uterus at the same time, hoping that one would implant, because these couples so desperately wanted a child, and we wanted so desperately to help them. But sometimes they would get pregnant with, all 4 embryos would implant, and that's pretty scary.
Yes. Yeah.
Right. So now the culture conditions have improved, and testing on the embryos has improved, so that most of the time we put back just one single embryo, and most of the time patients are successful.
It states, if you go to www.yukonfertility.com, there's a lot of stuff on there. You can watch programs that they produced. There's one on smoking, even, right from you that I saw, Dr. Groh.
Yeah.
Right? There's a
Smoking's
smoking
not good for fertility.
No. But anyway, it's a great place to go for information on getting pregnant. It's www.yukonfertility.com. Now, curious to know, I see that it's part. Is this program part of UConn?
It is. So all of the physicians have appointments at University of Connecticut. So I'm a full professor at the University of Connecticut, as are several of my colleagues. So we always have medical students rotating with us. There's 1 or 2 medical students in the office. There are 1 or 2 residents in obstetrics and gynecology rotating with us in the office. We lecture at the medical school. We do research at the medical school. We publish papers, at the medical school, and so it's a really robust academic center. Actually, lots of education, lots of learning. Sometimes we learn some things from the students too. It's pretty fun.
That's great. Yes, and as we said before, they've helped 15,000 babies, get born. And now this program, right? It's the biggest one in the state, right?
It is the biggest fertility program in the state of Connecticut. Yeah.
So that's the place to go if you have any problems, you have questions, if you're not sure, if you don't understand why or why not, you go see them at the Center for Advanced Reproductive Services, 6 Business Park Drive in Branford, 203-481-1707. We talked about low sperm count before. How can that be changed or fixed or helped?
Yeah, so many men with a low sperm count will see a male fertility specialist, and who'll do an exam to make sure there's not an obstruction or a varicocele or some other problems. And they sometimes the urologist will prescribe some vitamins or nutritional supplements or diet, or help get the man's blood pressure under control or things. Sometimes there's some surgical therapies also. And if none of those things work, then we'll do either intrauterine insemination and increase the proportion of sperm that get delivered to the uterus, or we can do in vitro fertilization.
Now, I wanted to know, this is kind of weird, but is it true that if the opposite is what they want, if they don't want children, you're right, there's procedures for that too, right?
There's procedures to end fertility, a vasectomy.
You do that?
No.
Oh, you don't do that at the center?
We don't do that at the center, but the urologists do.
Oh, I see.
Yeah, the problems that we most often see in women are things like endometriosis.
What's that, doctor?
And fibroids. So endometriosis is a problem that causes a lot of pain and painful menses for women.
Okay.
And pain during their menstrual cycle. And it's often caused by tissue, like endometrium, that implants on the tubes or the ovaries, causes scar tissue, causes inflammation inside the pelvis, and prevents pregnancy. And so that can be treated with some medicines. It can be treated by laparoscopy and looking at it and removing the lesions. And it can be treated with some of these fertility therapies too, like we talked about intrauterine insemination or IVF to help boost fertility. So endometriosis is something we often deal with. Many of our patients have fibroids. Many of our patients have some blocked fallopian tubes. We have other patients who may not have a partner. And so single women and women in same-sex relationships, lesbian women, are a significant proportion of our population.
Oh, you can do that?
Yeah.
Really? That's amazing too. Wow. That's great. So there's all kinds of things that you can do, right, to help a person get pregnant, to help a woman get pregnant.
Yeah.
It seems like you offer all kinds of things.
There's some things that are really cutting edge also. We had a patient not too long ago whose family was afflicted by BRCA1. So BRCA is a gene that predisposes to breast and ovarian cancer in women. And in men, it often causes prostate cancer. And so a patient came to me, and there was her father died of prostate cancer, her grandmother died of breast cancer, her mother had breast cancer, and her mother came to me with her daughter who was in her 20s and said, Dr. Groh, can you help us start a family without this BRCA gene? And so it's really wonderful. So we helped this patient with in vitro fertilization. And on day 5, we biopsied the embryo and took just a couple cells off the embryo and sent the embryo for BRCA testing. The biopsy of the embryos were frozen. The biopsy was sent for BRCA testing, and we knew which embryos didn't have the BRCA gene. And we replaced those embryos into her uterus. She has a healthy child, and I see the mother and the daughter occasionally. And they're so grateful that a new generation is now, without the risk of cancer from the BRCA gene. So we can do that with cystic fibrosis. We can do that with Tay-Sachs disease. We can do that with lots of other diseases. So the technology is really wonderful, helping patients start families.
That's a great thing to know. I mean, if people have this in your genes, if it's been in your family, and you want to ensure that your baby, comes out, great in perfect health, then this is what you want to do. You want to see these people. They're going to be staffing the Branford office at 6 Business Park Drive, and any problems with pregnancy, if this is where to go and who to see.
We also do the fertility preservation for oncology patients. Someone who's been newly diagnosed with cancer before they start their chemotherapy, because the chemotherapy can damage the eggs and decrease their egg supply. So we get them in rather quickly, get them started with an IVF cycle, and we have them freeze eggs for future use.
Yes, that's a very interesting topic that I was just about to ask about, and now sperm as well can be taken and kept, right? Right?
Correct.
So if that's an upcoming thing that you got to go through, cancer treatments, then this is the place to go first. Now, people become. I mean, as far as females becoming pregnant now, the old days, right, it was in the 30s, and then we used to hear maybe 40. But every once in a while, there's there's an actress, right, that you might be told about that's in her 50s, and so things are changing, right, doctor?
Things are changing, and some of those now, as Deb alluded, we have patients who with cancer can freeze their own eggs for later use, and that's becoming more popular. We have a lot of female professionals in all walks of life, and we see them in medicine, and who may say, now I'm healthy and 30 years old, but I'm not ready to have children yet, so I'm going to freeze some eggs for use when I need them, when I may be less fertile. So that happens commonly now.
Wow.
And it's not something that we thought a lot about even 5 or 10 years ago, right? Because the technology wasn't able to do that. But those actresses that you refer to who are in their 40s and have twins, now sometimes that happens because of donor egg. And you can, if one's eggs are not healthy as they used to be, you can use eggs from a donor, or as I mentioned, your eggs from a prior decade, and they're young and healthy. Donors' eggs are typically in their 20s, very fertile, and donor egg is very successful.
Yeah.
Wow, that's really something. I mean, there's all these possibilities, that people have, and these people can help you with, with your pregnancy. If you and your partner want to have a child and you're having difficulty, this is who you want to see, and I'm sure they'll be able to help you. At the time that I looked at Yukon. Fertility.com. I saw that you could call in and ask questions. Is that how that works, or?
We do have services that we reach out to folks, and sometimes we do, free screenings for certain hormones, and we do have programs where people can call in and ask questions, and
Yeah, I do some of those calls.
Oh,
where
you do? Uh-huh.
somebody calls in, they have a question, they get referred to me. I'll call them, just a brief conversation, find out what's going on. We talk a little bit about, services that we offer, things that might be helpful for them.
So, do you have any idea as to how things could change in the next couple of years? I mean, how does the research look right now, Dr. Grove?
That's really a fascinating question. We've come a long way. The big new thing that I'm not sure how much it's going to take up is uterine transplantation.
Wow.
Right? I mean, we know heart transplants and lung transplants and liver transplants, and, should we pursue uterine transplants? There are women who are born without a uterus. There are women I had a patient, yesterday who had just terrible fibroids for the uterus, and most of the time we can carefully remove the fibroids, and the uterus is then fully functioning, and they carry a pregnancy that's healthy and reaches a term. But sometimes, patients have had 2 or 3 uterine surgeries already, and is uterine transplantation something that's going to take off? If anyone in the audience has seen this week's Time magazine, they talk about uterine transplantation and about mitochondrial transfer and how do you make sick eggs or old eggs better. And that's not currently approved by the U.S. government for embryo transfer, but and many of us know about genetically modified fruits and vegetables.
Oh, yes.
Right? We
Yes.
have all kinds of fruits that stay on the shelf longer, and they're fresher, and they don't spoil so fast. And there's a genetic technique called CRISPR technology where you can edit and remove, a single gene and put another gene in, and whether or not this is acceptable, for human embryos, I think is a huge question.
Yes.
Should we do genetic editing of embryos? But there's a lot of exciting technology, and these little developments are really helping us to grow embryos better, to improve our fertility rates, to make the basic technology more successful, so that we keep getting better and better each year.
It's great to hear, and as I said before, they're opening right here in Branford. They're going to be serving the shoreline. They're going to go into New Haven, and any questions or issues you have with pregnancy, again, this is the place that you want to go to. Because of their work since the opening in 1984, they brought 15,000 babies into the world through their work, and it's the biggest operation in the state, And as we said at the beginning, that's completely confidential. You can go in there, and and it's totally confidential. It's a very difficult thing to talk about. You can't really ask your coworkers, "Oh, I can't get pregnant. I don't know what's wrong with me." These are people that you can go to. I've been talking to them for about an hour now, and they're very warm and kind people, and they're going to be staffing the Branford office right at 6 Business Park Drive. So you can call for an appointment, and the phone number is 203-481-1707, and check out the website. There's a wealth of information there. It's www.uconfertility.com. So it's a very interesting and exciting field to be working in. One last question before we go. How did you get involved in this field, Dr. Grove?
Well, that's a long answer.
That's all right.
So I started out as an OBGYN, obstetric and gynecology resident, and I did my 1-month rotation in infertility with a mentor, and I just fell in love with the field. I fell in love with the ability to help people have a family.
That must be, wonderful, because you can see the results of your work, right?
Right, and we have children. I have 3 children, and children are the joy of my life and the joy of my wife's life, and to be able to help other couples is really exciting.
And I was going to ask you, how did you get into the field, Ms. Hines?
Labor and delivery nurse for a long, long time, and knew somebody, a friend, a nurse that worked at the center, and in talking with her, got me interested. So I started working there as a nurse for several years, and then liked it so much and wanted to be able to do more that I went back to school to get my master's degree and became a nurse practitioner, and here I am.
That's great, that's great. Okay, well, anyway, thank you very much for being with us, and we're extremely glad that you're going to be here in Branford. So I'll give the number again, one last time, 6 Business Park Drive, the Center for Advanced Reproductive Services, part of UConn, and the number is 203-481-1707. And again, thank you both for being with us today. It's great work you're doing.
Thank you.
Thank you. Thank you for having us.